Hello everyone, welcome to this very quick session on data on persons with disabilities. Data on persons with disabilities is something that is a very recent topic, but despite being recent, it has actually gained a lot of attention in the last few years. And that's what we are going to talk about today with you to help you collect data on persons with disabilities while doing your job. The first thing that I wanted to ask, and that I ask in every training that we do, is what is the first thing that comes to your mind when you hear the word disability? Stop for a few seconds and think about it. I like asking this question because every time I do it, I get very different answers, right? Some people talk about people's limitation to perform activities. Others focus more on the challenges, the obstacles that exist in our society so people with disabilities can participate. Some people talk about the different types of disabilities. Regardless of where I'm doing this, I always get different answers. And I ask this, and that goes to show that even if we are talking about one word, that word still has different meanings for different people. And the reason for that is because there has been an evolution of the understanding of disability, right? So until the 70s, disability was very much seen as someone's medical condition, someone's impairments, right? So if someone was in a wheelchair, the fact that that person couldn't walk was their disability. In the 70s, there was this big civil society movement led by persons with disabilities. And what they said was, well, actually, the fact that I'm in a wheelchair is not a disability. The problem is that wherever I go, there are no ramps, there are no accessible toilets, so I can't, move independently, safely, so on and so forth. So that the fact that society and that the environment is not adapted is what is disabling. So that is a disability. I only have a disability because the environment is not accessible. So this was known as the social model because it had a more social view to the definition of disability, right? 2006 is a very important year for the disability movement. It was when the Convention on the Rights of Persons with Disabilities was published. And in the convention, the definition actually changes a little bit, looking at disability through a more human rights lens, right? So the convention defines disabilities as the combination between someone's impairment and these barriers which exist in the environment. So the challenges and the obstacles that persons with disabilities face on a daily basis. However, as I said, disability is a constantly evolving concept, and there has been 16 years since the convention, and obviously there has been some updates in terms of how we define disability. It's not such a drastic one as you could have seen from the medical to the social to this one, but it still brings in new elements. So the definition that we have today looks at someone's impairments, as we said. So if someone has a physical, a visual, a hearing, a speech, a cognitive impairment, an intellectual disability, if someone is neurodivergent, such as those with ADHD, those in the autism spectrum, so on and so forth, and obviously people with severe mental health conditions. So mental health conditions that actually impacts someone's ability to perform daily life activities. So the combination of those with these barriers that exist in the environment, and we are going to look at barriers just in the next slide, but it's anything that basically limits someone's ability to participate meaningfully, equally, and safely in society. And other intersecting personal factors, and these can be someone's age, someone's gender identity, if someone is a migrant, an IDP, or a refugee, if someone comes from a political, religious, or ethnic minority, someone's race, nationality, economic background, all of these things that make us up as humans, right? So what we say is that disability is the interaction between the impairments, the barriers which exist in the environment, and other intersecting personal factors, right? So this is where we have disability. And the important thing here, and I think the new advantage of this kind of updated definition is that it looks at people with disabilities as, first and foremost, as people, right? We have this tendency of looking at persons with disabilities mostly at the disability, but this person is a person before anything, right? So this definition, which brings in these other elements that make us up as who we are, highlights the fact that, again, we are talking about human beings who are unique and who go through different life experiences, and that needs to be reflected in the definition of disability. And the definition of disability is important so we can make sure that persons with disabilities are included in society as well as in the activities that we do as IOM. So I said that I was going to talk to you about barriers. So barriers are those aspects of life that intentionally or unintentionally exclude and discriminate against persons with disabilities to participate fully and meaningfully in society. And I highlighted unintentionally here because, sometimes we don't mean to do something, but we end up doing it. So it's very important that we pay attention that even though we don't want to impose barriers to persons with disabilities, often we do. The types of barriers are institutional, so the laws, the policies, and the regulations that either are absent, so either absent laws, policies, regulations which protect the right of persons with disabilities, or even such instruments which discriminate against persons with disabilities. Physical and communication, so this is mainly lack of accessibility, and obviously for someone who has a physical disability, physical accessibility, so the existence of a ramp, of an accessible toilet, is what matters the most. Whereas for someone with a hearing impairment, for example, accessibility of communication is what's most important. So it's lack of accessibility as a whole. And attitudes, right? So discrimination, abuse, exploitation, neglect, anything that is harmful to persons with disabilities. So negative attitudes as a whole. So talking a little bit about data, getting to our point, why is data for persons with disabilities is important? The first thing that you need to know is that there's usually absence of reliable data on both the overall number of persons with disabilities as well as their situation, right? Whereas it's very easy to find what's the number of children, older persons, or men and women, because it's very straightforward to count. Collecting data on persons with disabilities is not the same. Therefore, what we see is that we either don't have that data or that data is not reliable. And why is it important for us to collect? So first of all, data on persons with disabilities can inform strategic planning at country level, for example, and it can also inform specific programming. So if you're doing a project, for instance, you want to know what are the needs of persons with disabilities and how many persons with disabilities are there. So you can calculate, like for instance, the number of accessible wash facilities that you will need to build in a camp. What are the actual needs for staff, for training to your staff on disability inclusion, for instance, right? So what are the types of data that can be collected on persons with disabilities? The first is the most straightforward one. It's the one that we receive most requests on, which is on prevalence. So how many persons with disabilities exist in a given population? You will see here that there's a 15%. This is the official global estimate for persons with disabilities. It was calculated in 2011 by WHO. They did this report, worldwide report, and they found this prevalence. But please note that this is an average. They actually found that 80% of these people actually live in low and middle income countries, and the lower the development level or the higher insecurity and instability in a country, the higher the prevalence rate is likely to be. And then we have risks. Again, different risks that persons with disabilities face, such as discrimination, gender-based violence, so on and so forth. The barriers which they face, as we were saying, the absence of a ramp, the absence of accessibility, the absence of a sign language interpreter, and what are their preferences and what are their actual needs. So the other two we don't really collect much as IOM, so that's why I'm focusing on these four. When we want to decide how you're going to collect the data, first thing that we need to know is why are we going to use that data for, right? So this is the first thing that you need to think about when you want to decide what is the methodology that you're going to use for disability related data.
Once you have identified that the defined purpose of your data collection is such that you need prevalence data on persons with disabilities, then you will use the Washington Group questions to collect disability prevalence data. The Washington Group questions must be used as they are without adaptation at individual level or a household level through an individual roster and through a representative sample, a sample designed so to give representative results.
One interesting thing about prevalence is that we have the most common methods of data collection that we have are simply asking someone, do you have a disability, yes or no, or the examples that you can find here in this slide. So you have a question there and you just say how many pregnant women, how many persons with disabilities, injuries, or you can just ask how many persons with disabilities are in this location, how many persons with physical disabilities are in this location, how many persons with mental disabilities, which is, by the way, a terminology that does not exist. It's wrong. Please don't use it. And what we found using both of these methodologies, or anything that actually tries to count the number of persons with disabilities by asking very directly if that person has a disability or how many persons with disabilities are there, is that we have very, very low prevalences. Remember the 15% prevalence rate that we discussed. So that shows us that this method here is not the most appropriate one. But I just wanted to show this to you here because this actually influences a lot about our next slides.
There are consequences if we use the wrong method or language. If, for example, we use the interviews with in key informants to ask about number of persons with disabilities, or if we use the word disability in questions to individuals or households. As we saw, we get a very low prevalence. 1 and 2% are much, much lower estimates than the 15%, which is commonly accepted as very much the average everywhere. Asking key informants about prevalence of persons with disabilities or using the word disabilities when asking individuals or households does do harm. Does do harm to persons with disabilities and hinders the efforts to respond to the needs of all groups. So as a consequence of using the wrong method and language, we misinform both donors and the humanitarian community. We probably will obtain less funding for specific programming or for ensuring that all humanitarian response is inclusive of persons with disabilities.
As we said here, you can always, while you make sure that your team is able to use the Washington Group questions as they were meant to, you can use as a temporary compromise the 15% prevalence. And what I will say is that using the Washington Group questions will lead to much more accurate data. That is for sure. Usually what we get in the countries where we operate is a prevalence from between 18 to 30%. So that's how much you might be missing out if you are to use the 15%. So always better to build your capacity and get the necessary resources so the best methodology can be applied and we are collecting the most reliable data possible.
If, on the other hand, you have identified that you need to collect data on barriers obstacles to service and goods. You can use the DTM and Partners Field Companion questions through key informant interviews. These were questions developed in cooperation between DTM, IOM, UNHCR, UNICEF, Humanity and Inclusion, and Oxfam experts on disability inclusion at global level. They cover different areas of the humanitarian response and obstacles and barriers to accessing services and goods for persons with disabilities. They can be adjusted, not unlike the Washington Group questions that cannot be adjusted. These questions can be adjusted and should be adjusted to the specific need and to the specific context.
I will finish with 2 slides, which is something that our wonderful DTM team has used to help you think through the process of collecting data on persons with disabilities. So this is a summary of what we have discussed today. So here we have the different types of data that you will need. So read through that and decide which one is the data that you need. That is going to lead to the actual type of data that needs to be collected. And then the first exercise that we do is that we need to think about if this data already exists, right? As I said, the number of data on persons with disabilities is very limited, but the number of reliable data of persons with disabilities is even more limited. So one thing that is very important to do is that if there is existing data, that you do an exercise to know if this data is reliable. So there are a number of things here, a number of criteria that can give you good information about if you should be using that data as a source or no. So for instance, on prevalence, as we were discussing, a very easy way to know whether or not this data is reliable, even if sometimes they say they were using the Washington Group questions, is that if the prevalence they found was really low, if the prevalence they found was lower than 12 or 10%, you can be most certain that this data is not the data that we want to be using. And for the other types of data, you can also think about, for instance, the use of stigmatizing language. As I was saying, like the use of mental disabilities, which is a very stigmatizing terminology about persons with disabilities. And after that, after you make that decision, if you think that the data that exists is good, that the source is good, it's reliable, you can use that one. It's much more cost effective to do a secondary data review than actually collect primary data. But if you think that it's not enough, you can go to the next step, which is this one. So in this page, you're going to be detailing the process that you are going to be taking. Here you have the process for prevalence data, which is what we said. You can use the Washington Group questions, and we are very happy to support, or you can, as a compromise, you can use the 15% while you start building up your capacity to use the Washington Group questions adequately. And then what you need is data on barriers, on needs, on preferences. You can use the other methodologies that we mentioned before. These are all detailed here. And of course, please contact myself, contact Simone Holiday or Downia Pavone for more information on the topic. Thank you very much, and I wait for your contact on data collection for persons with disabilities. Thank you.